WMNF Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
How you getting on? Up early, my steadfast friend, my kinfolk of the airwaves, and welcome to the Healthy Steps radio show here on WMNF Tampa, the only community-supported radio station that they stream in Sicily, Alaska, and you can stream us as well at WMNF.org. Well, great day in the morning. Nothing could be finer than to open the magic portal to another Ask Me Anything Monday. So, my invitation to you today, my compadre, is to call the Healthy Steps radio show. And this show does depend on your questions, comments, and concerns. So let's keep my favorite phone commander, Irene, busy this morning. Just give us a call at 813-239-9663. That number again to call is 813-239-9663. You can also send an email to dj@wmnf.org. And if that weren't enough, you can also text us at 813-433-0885. Good morning to you, Dr. Harvey, and I hope that you had a spectacular weekend and you are now rested and fully prepared to guide us through another AMA Monday. Your patient and loyal listeners have waited a week for this moment, so let me just turn this show over to you as I scarper out of here. What is the lay of the land today, Doctor?
Well, good morning, Bill. Glad you're back.
Pleasure's mine.
So, happy Monday, everybody. I hope you also did have a great weekend. Mine was very nice and relaxing. Started today again with, actually, I had a nice walk every day. Got my healthy steps in all over town. Had some forest bathing and some beach walking and just some neighborhood strolling this morning before I came to work. What did you do today for your healthy steps? Did you start your day with something good? Did you drink a glass of water the moment you got out of bed? Did you have some kind of fruit or vegetable for breakfast? These are all very little steps you can take that would help get you healthier. And, you know, it's really amazing how many things we have available to help us very simply. And also some really amazing new medications. Just this past week, more data was published January 20th in the magazine Nature, one of the most respected peer-reviewed journals on the planet, has an article called Mapping the Effectiveness and Risks of GLP-1 Receptor Agonists. The Ozempic, Wegovy, Mounjaro, all these different medications that have been developed to help to treat high blood sugar. They're able to reduce your hyperglycemia, is the word, that's associated with diabetes and pre-diabetes situations. And they don't do it the way other diabetes medications do. Insulin itself is the original diabetes treatment, essentially. When your body stops listening to insulin, you have an elevation in your blood sugar because the insulin helps put blood sugar inside the cells instead of in the blood. And then as the pancreas gets tired over time, trying to produce too much insulin, it may also result in having the pancreas damaged such that it reduces the amount of insulin that it produces. Inflammation can do this too. Gluten sensitivity, dairy allergy, infections, and other autoimmune stimulating triggers can actually damage the pancreas and reduce the amount of insulin produced. If you still make insulin and you do have some function of the pancreas, there are many medications that have preceded the GLP-1 medications to the market. One of the earliest classes of medications are called sulfonylureas, and they are very effective at helping the pancreas produce more insulin. And so if you're making insulin, you can use these. There are several other classes that have come along in the last couple of years. And the medications have been actually compared in this large retrospective look at things. It's not exactly a trial. It's actually looking at all the other trials and looking at how these things compare with each other. And the GLP-1 medications are actually having better results than any of the other medications. And it's because this group of medications addresses inflammation. Inflammation is what causes insulin resistance and type 2 diabetes. Inflammation is what causes many of the outcomes of diabetes that are unwanted. Inflammation causes the hardening of the arteries and the clotting risk. And these are some of the things that come along with people who have diabetes. And so we can actually block some of the negative outcomes of diabetes by taking this medication. And we can do it better than some of the other medications that have been out there. But every medication we use does have a risk of adverse consequence. The adverse consequences for these medications are lower than their benefits, much lower than the reduced risk of other problems. And so the use of these medications is warranted, but it's also, it requires that you have a doctor that's paying attention because there are adverse outcomes. The thing is, it seems to me that when you look at the adverse outcomes that result from using the GLP-1 medications like Ozempic, is that I think they're associated with the diseases of excess that we actually have as the causes of many of these things originally. So if you use Ozempic or any of the other medications to cover up your bad behavior, it's likely you're going to result in some bad outcomes. So nausea and vomiting and gastroesophageal reflux disease. Well, this comes from eating the wrong foods. If you pay attention to the foods you're eating and you don't eat, a whole coconut cream pie and expect Ozempic is going to make your blood sugar happy, then you're living in a world of fantasy. If you, drink 6 beers every night and expect that Ozempic is going to make your sugar happy, you're living in a delusion world and you're going to get outcomes you don't want. It actually improves kidney function, but it causes kidney stones. And kidney stones are more common in people that don't drink enough water, that eat too many sugars and too many fats and too much heavy protein. The combination isn't well tolerated by a body that's already under pressure. And so abdominal pain, sleep disturbances, these things can occur in people in general, and definitely can be induced by food. And what's interesting is I looked at this analysis, and they tell us of all the things that they controlled for. Because when you have a variable like a medication coming into a human, there are many other things that could interfere. So they controlled for all kinds of variables. It was really impressive. They looked at all kinds of things, but you know what? They did not look at one major thing. And it's difficult to look at this one, but it's very important because without this data, you can't really actually say that you've looked at all the variables. And this is the biggest failure I see in the way people are looking at these medications and looking at this study. Well, what they adjusted for was health behavior, including smoking status, vaccination status, excuse me, for influenza, colonoscopies, esophagoscopies, medication use, all kinds of different medications. They adjusted for all those things. They adjusted for when the treatment was assigned. They adjusted for where they lived in geographical areas. And what's funny is they did not actually adjust it for diet. You know, that simple thing that actually causes the diabetes in the first place. They didn't look at whether people were eating a pound of sugar a day and whether that contributed to the adverse outcomes. They didn't look at that whole huge variable, which is critical. Why, people get reflux because they eat the wrong foods. People get kidney stones because they eat the wrong foods. This is a problem. They didn't look at the most important variable from my perspective, because it's the variable that most people can fix most readily. And so it's really, really important that the researchers actually get the right data. And the only way they can do that is by asking the right questions. And I bet there's a bunch of people out here that have some questions they want to ask today.
Well, there certainly is one. I've got Justine from Sarasota, but I'm not satisfied with just one. I'm going to say, if you're just tuning in, welcome. You're listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. And we're inviting you to participate by calling 813-239-9663. I appreciate Irene coming on in, so let's make those phones ring at 813-239-9663. Or send your emails to dj@wmnf.org. Good morning, Justine. Welcome to the show.
Hi. Hi, good morning.
Hi, Justine. What do you have for us today?
So I'm on omeprazole. I heard you talking about GERD earlier. I have monitored my diet pretty carefully. I've eliminated what foods I thought were causing it. I've cut out coffee, et cetera, et cetera. But I'm on omeprazole, and I don't want to be on it long term for a lot of reasons. So I've ordered up I looked online and I've ordered up some curcumin, and I was wondering if you could talk to dosage or any other remedies aside from, the proton pump inhibitors that we are prescribed.
Sure, that's an interesting choice that you made for curcumin. Curcumin actually causes some gastrointestinal upset in people when doses are used too high, and may even cause some stomach, pain. Possibly, you might notice it in reflux. So, not my first choice for anything associated with GERD.
Okay, there's a new study apparently that says it's just as effective as omeprazole.
Okay. So many of my patients that have been on omeprazole have been able to get themselves off using famotidine, one of the oldest ulcer medications around. It's an antihistamine, and it works on your stomach by reducing histamine effect there. It's highly effective, but you have to use it regularly, just like the omeprazole, to get off of it. And then you can taper that off. Omeprazole is addictive. Most people can't get off because the way it works on your acid production in your stomach, when you stop taking it, you have a vast dam break, and the acid comes out and you feel terrible. So you have to use some kind of medication to prevent the omeprazole addiction release of acid. And so medication is necessary from what I've seen in everybody trying to get off that addictive medication, omeprazole or any of its relatives, pantoprazole or whatever else is out there. The medications, or actually the nutritional supplementation that I've found that really is effective at helping with those upper gastrointestinal symptoms, is a combination of aloe vera juice, deglycerized licorice. That means that it's had the chemical removed that causes high blood pressure. It's very soothing for the lining of the gut. L-glutamine is also a very good supplement that helps with healing the lining of the gut, and so is arabinogalactan. I get those together in one supplement called glutalomine, and a teaspoon or a scoop of that before all meals is really effective. GLUTALOEMINE, glutalomine. Very good stuff. But another thing you might want to consider, and anybody who has GERD and wants to actually get off of omeprazole or even get off of the H2 blockers like famotidine, that is to look at the histamine foods coming into your diet. Look up a lower histamine diet. Avoid things that have histamine like tomatoes and strawberries, avocados, and you might find that you have a reduction in symptoms.
Okay, well, thanks so much.
You're very welcome. Have a great day, and good luck with that.
You too. Thanks. Bye-bye.
Well, that seemed to work. I've got the boards all lit on up here. I've got Steve, Bob, Joel, and Mary. Let's go to Steve in Clearwater. Good morning, Steve.
Hey, doctor, how are you?
Excellent. How are you today? What do you have for us?
Good. Thanks for taking my call. So my recent TSH test, the thyroid stimulating hormone, the reading was somewhat high. It was 6.18. And I called on this a while ago, and my doctor was pretty instantaneous about putting me quickly on levothyroxine without really doing any other tests. Just seeing this TSH with my annual blood panel. And so I was wondering, he says this is sort of a subclinical hypothyroid, and I may be on it for life. Can I reverse hypothyroidism if I have it? And do I even have it? Do we even know yet? Is my question.
Those are really good questions, and I'm glad you're critically thinking about this. I hope you didn't start the levothyroxine yet.
I did not. I know the script
good choice.
Is in there and delayed and waiting, so I'm delayed and waiting.
So it's interesting. About 15, I think, maybe even 20 years ago, I think it was 15. I went to a lecture in Tampa that was put on by Harvard endocrinologists, endocrinology for primary care doctors. And the thyroid doctor was talking about this. And he said, when you have somebody who has a TSH between 5 and 10, it's kind of borderline, and it may not really be hypothyroidism. It could just be some dysfunction. That TSH will actually go up if you've actually had a problem with iodine intake or with protein intake. There's all kinds of things that will change it. And so having a slight abnormality in it is not to be treated according to Harvard endocrinology. They said, wait and recheck it. But unfortunately, watchful waiting from the Harvard endocrinologist is kind of like standing in a corner and staring at the wall. And so I asked him specifically, okay, you have a person that's waiting there. What do you recommend they do? I have a lot of patients that want to take some iodine. What should you take? He said, whatever's in a standard multivitamin. I said, that's an interesting answer, considering there's a zillion multivitamins and some have iodine, some have none, and some have different varying doses. So what, sir, from your pontifical position at the top of the ivory tower at Harvard, is your dose of iodine? He said, this dose that's in a standard vitamin.
Oh, boy.
It's really sad that actually the teachers need to be taught some stuff here. And so, unfortunately, those are the teachers that are teaching primary care doctors. So primary care doctors are doing the knee-jerk response of every prescriptionist in America. Prescribe! Let's prescribe a new pill. Why would you go on hormone replacement therapy when you haven't even documented a thyroid problem? TSH is a pituitary hormone. Why don't we do a thyroid panel and figure out if the thyroid actually has the right amount of hormones?
Right.
Boy, oh boy, that's a really interesting clinical step that a critical thinking doctor might consider.
Well, and in this time that it has fluctuated in the range and out of the range, I have been vegetarian. So I'm thinking, let me look up that. And could I possibly have a low iodine deficiency or something? A deficiency in iodine. So what's your best?
Well, as a vegetarian, how many sea vegetables are you consuming?
Not many. And
there you go.
I started to add some nori, and there's great ways to, I added nori sheets, just little bits of it throughout the day.
Okay.
And what else could I do?
Well, I think you need to make sure you're getting adequate protein. You're a vegetarian, and my biggest issue with vegetarians is most of them don't get adequate protein to support their skin, hair, bones, nails, and enzyme functions.
Okay.
And so if you're not getting 0.5 gram of protein per pound of body weight a day, you're actually starving yourself.
Well, I'm fine actually adding fish to my diet.
Okay.
I love fish, and I really love salmon, so I could easily add. I was doing it more for health reasons, but it's kind of rocky to do it as a vegetarian.
Yeah. I think salmon's a great choice, and so are shrimp. Shrimp don't have huge omega-3s, but they've got iodine. If you get Key West pinks out there in the middle of the Gulf, you have a lot less grotesque chemical contamination than you get from around the shore, like Apalachicola browns are kind of scary because they're up there in the Mississippi effluvium.
Yeah. What is there? Is it necessary at all to test for iodine, and is it even accurate?
You can test for iodine, and the best ways to do it are really doing like a 24-hour urine collection, possibly even doing a challenge. There's a Dr. Brownstein that talks about doing an iodine challenge. But honestly, I think you just need to get on iodine. Eat your nori, possibly take a vitamin that has some iodine in it. 6.25 micrograms of iodine is not a big dose, and it's available at any health food store. So there's all kinds of ways to get it in there, but get a full thyroid panel. Get a free T4, a free T3, a reverse T3, because reverse T3 tells us if you're actually throwing away excess thyroid hormone. Then you want to get a thyroid you get thyroid antibodies. You want to get an anti-thyroid globulin antibody, and you want to get an anti-tissue peroxidase, TPO antibody. Those are the two thyroid antibodies that would tell us if you have Hashimoto's disease. Hashimoto's disease interferes with thyroid hormone production. So your doctor needs to actually do his job, not abdicate the responsibility and make something up and treat something that isn't.
I actually got the antibody one, and everything read normal, thankfully.
Good. So it's probably your diet.
And I had to do that myself because he said, no, you don't need to get that one done, so I need them.
Wow. This guy doesn't know what he's doing. I think you need a new doctor. He's really absolutely not applying any kind of differential diagnostic critical thought to your care. Bad news. Yep. Bad decisions are being made.
He just went with the TSH test. Yeah, I know.
Yeah, that's lame because that's a pituitary test. It's not even testing your thyroid. That is an abdication of medical responsibility. Malfeasance.
Right. I'll get the other versions too you mentioned. Thank you very much. The
good luck with that, Steve.
The T4. Yeah. Thank you.
You're welcome.
And thank you there, Steve. Yes, I've got the board all stacked on up like O'Hare Airport. I've got Bob, Joel, Mary, and Jack. So let's go to Bob in Plant City.
Good morning, Bob.
Good morning. Good morning. Hey, first of all, I wanted to say thank you for the show. I'm going to a little editorializing first. I'm 65, had triple bypass a few years ago. But as you know, I think so much that is wrong with us is self-inflicted by diet and the things that we do and the cheats that we think we can cycle into our diets. And that's very distressing, that, the healthcare system is stressed by people just being stupid in the things they put in their body, the way they treat their body, and what they do as far as exercise or lack of exercise. And that's just a little editorializing of what you obviously proclaim and profess in these shows. It's ever since my bypass, even before my bypass, I was very heavy in my 30s. I was 280. I got down to 160. I've changed my diet completely, never eat processed foods. Like Jack LaLanne says, if somebody made it, I don't eat it. And I cook for myself. I see a lot of these shows, a lot of these programs or commercials that say, get the Factor, get all these pre-made dishes with all the sodium in them. And I think, why don't people just cook? So everything just sort of getting it out there to your audience, just eat right, exercise, drink water, and all those little things that we do in the dead of night where we cheat and we think that nobody's looking, they're killing it. They're going to do a job on your body, and it takes discipline.
It does take discipline, Bob. Absolutely.
And I run. I'm lucky. And, it's funny. When I had my bypass, I was standing at the window and I watched people walk by the window, and I'm like, will I ever be able to do that? And, because I've really, really taken good care of myself, and I don't cheat at all. And it's hard. I want a piece of cake, and I want, especially the holidays come by, I want those cookies. But, people look at you funny, and there's a social stigma, too, to, passing on things. It's it's ridiculous. You'll be sitting around with people that are overweight. They're all looking at you like, what's wrong with you? And you're like, I just can't do it. I'm sorry. I just can't do it. Anyway, I was watching people walk by and to thank God, I do now 3 to 6 miles a day, not a day, a week, it really, I am here as a 65-year-old man to tell your audience that it's food, it's exercise, it's all the simple, smart things that you think that are hardest to do. If a doctor said, okay, I can heal you, what you have to do is you have to drop 50 pounds, you have to eat right every single day, you have to drink, lots of water during the day. Please, God, doctor, just give me the pill, and it's unfortunate. That's unfortunate.
Yeah, it is. I just saw it was an article, and then it was a lead to a TikTok from some Indian woman talking about how some Chinese surgeon has a new way of treating Alzheimer's. You unblock the lymphatics. And my thought and my response was, there's no surgical cure for a metabolic disease. Stop looking for magic bullets. Do the work.
So I'm interested, maybe you will talk a little bit about what that work is, because as luckily...
You just said it. That's the work, the basics. Look up the blue zones online. The blue zones are a bunch of places around the planet that a National Geographic explorer found and did some extra research on it. And the ones he talks about in his website are not the only ones, but they are the ones he studied. And they're places where people live by common sense rules. One of them is have a purpose in life. Get up in the morning with something to do. People who are unemployed have a really big trouble there because they don't have a purpose. And then you need to have good family or support networks, a tribe of like-minded people that you can learn from and grow with. You need to eat whole foods, 80% to 90% plant, 10 to 20% animal. Push back the plate when you're 80% full. Drink clean water and lots of it to flush the system. Move naturally every day. 20 minutes of walking has been shown to turn around type 2 diabetes, depression, and cancer risk. So it's basic, simple stuff that many people just can't get done.
And thank God, Dan, I'm doing okay. I've seen the blue zones. I'm like, yeah, that's me. I look at the list. I'm like, I'm doing that. So yeah, but it's hard. It takes discipline.
It does. And you know what?
Go ahead.
One of my best friends has a statement. I don't know whether it was his or from somebody else, but do everything in moderation, including moderation.
Everything in moderation, including moderation. I've heard that before, and I love that statement.
There are some days when you need to actually have that treat, but pick the right treat. I have discovered that if I actually decide I'm going to have something that tastes really good that's made from gluten, I know that 2 days later I'm going to have mouth ulcers because leaky gut occurs 2 days after I have had my gluten insult. It'll start eating away at it right then, and I'll have symptoms 2 days later. So it's not worth it for me to subject myself to the abuse of gluten.
I've got my treat. My treat is raw almonds. I eat a lot of raw almonds, but I know that, again, moderation, you have to be careful sometimes because there's a lot of fat in them, but they're great.
But do they cause a problem for you?
No. Except,
right. So they're not a big issue for you.
No,
what I'm talking about is people that willingly and knowingly continue to insult themselves with things they know make them feel terrible. And sometimes they're unaware because they do it so often, they have no idea why they feel like a lump of pain.
Yeah, it's the hypothalamus again. It's like I want that pleasure, and they just, from alcohol to Twinkies, it's all the same, and we have to push back on that. I have one quick question, and I'll let you go on to your other callers. Maybe you can just address this. The one thing I couldn't get off of is my statin. Cholesterol, no matter how well I did, it stayed. My cardiologist like, you gotta do it. And then there was a little bit of like, maybe also it's a little bit helps with Alzheimer's because it clears out, the plaque in some of the the smaller vessels. I'll get off the phone and listen to your answer on air if that's okay.
Wonderful, Bob. Have a great week and have a great year. And you have made a good decision to stay on the statin. Anybody who has an illness that's required surgery and you've had a triple bypass, statins help prevent the progression of the vascular illness. There are lots of other things to do, including staying on your Blue Zones lifestyle. That's really the key. The statin will help prevent your next event. And as long as you're not having adverse consequences from it, and you probably won't because you do the Blue Zone kind of living, you won't be likely to develop the diabetes that is a risk for taking statins long term. But that's for people that use statins to cover up the symptoms of bad lifestyle. And then the potential for other problems that might come from it, liver disorder, you can watch your liver enzymes. If they're normal, they're normal. They usually go bad in people that are abusing themselves. And so I think that we have medications that can help reduce the impact of illness. Why not use them? If you can't do enough in natural interventions to keep you from having the illness, use a medication. I'm an integrative doctor. I'm not someone who ignores the fact that science has provided us tools that help us thrive. Why would we ignore the tools that science has given us? I mean, our creator gave us science and scientists to study the science and then to create tools that we use. So, use them. It only makes sense. Who's next?
Actually, I've got Joel, Joel, Mary, and Jack. Let's go to Joel in Tampa. Good morning, Joel.
Hello, Dr. Harvey. I'm Joel Chudnow. I've been teaching and advocating holistic health and natural hygiene for 31 years in Tampa.
Fantastic.
Hillsborough Community College. I hosted 923 radio shows. I'm 78 years old, and I have to say that old age is not for sissies.
So true.
I've fired many primary care doctors. I use a registered nurse, a certified nurse practitioner as my primary care right now. She's kind and loving and considerate, and she listens to me. My purpose is to continue teaching, and I'm mostly vegetarian, but I got a tough question maybe for you.
What's that?
Most doctors just ignore any possibility of reversing what I have now at 78 years old, cataracts. I don't want a procedure for cataracts, and I will do anything to reverse cataract. I don't even want to hear a suggestion of a medical procedure. I react to eye drops when for testing, and so for 36 years now, actually, I've been organic mostly and mostly vegetarian, occasional piece of fish, and it's a puzzle. It's hard to find literature on the subject of reversing cataracts because so many people just walk in and their doctor recommends the procedure and they say, it's safe. Well, it's not safe for everybody, but it's safe. And many people get it done successfully. I'm not interested. So
I hear you. So So I've been doing integrative medicine since 1996, and I have yet to find any natural intervention that reverses a cataract. I have read numerous studies, seen numerous photographs of dogs and rats and other animals that they've used drops and such in to help change it. The dog studies had some really good results in acute traumatic cataracts. But you have a chronic degenerative cataract, and I have yet to find any natural intervention that actually really reverses the process. It'll be great. I would probably be retired now had I found this, because there are millions of people that go for successful cataract operations every year with very low complication. They wouldn't still be doing it as frequently as they do if it were highly complicated or caused lots of adverse consequences. I've seen a few people that have had the experimental lenses and other things placed that have had recurrent trouble with them. Those are the only people I've seen with recurrent trouble from cataract operations. So I've looked at L-carnosine eye drops and other antioxidant eye drops, and there's another study that just came across with the same kind of dog eye changes. I think it's for acute traumatic cataracts. I have not yet found anything that works. And Joel, I wish you luck in searching for it. I hope if you do find it, let me know, because lots of people would love to hear about it.
As your previous caller said, he has become very responsible by doing this study and making changes in his life. And especially with those of us with chronic disease, I have more other symptoms as well, but it's really, when the doctor says, sorry, I can't help you, or this is all I can do for you, it's up to us to do the study. The information's out there. And I'm going to keep searching, and if I find it, I will let you know. How can I reach you when I find this and share this with you? You could email Doc at Functional Medicine Florida. You could come on here again and tell the whole world. And you could call my office at 941-929-9355. Let us know. I'll get the word out if you find some new answers. 941 929-9355. 929 9355 is the last four. 9355. Okay. All right. Thank you, Doctor. Keep on keeping on. You too. Keep teaching. I love that. Thank you for your work. Thank you. Bye. Bye-bye.
Thank you there, Joel. And let's go to Mary. She's been waiting patiently. Thank you, Mary. Good morning.
Thank you. Thank you for taking my call. First, to Joe, I also tried natural remedies for cataracts for years. Nothing worked. I was terrified to have cataract surgery. Guess what? I did it. It's remarkable. I really wish he'd reconsider. But anyway, apart from that, Dr. Harvey, I want to thank you, because about 3 weeks ago you mentioned muscle activation therapy. Yes. And I found the best one I could in my area in St. Pete, Jeremy Warner. He's terrific. Fantastic. I'm on my way to see him now, and I just want to let you know how much I'm grateful to you for that information. Thank you.
So how much has it helped? Have you changed?
It's helped quite a bit. I've gone to 2 sessions right now. He did an hour and a half each time. He does what he does, and then he gives you exercises to do at home, and the soreness of my muscle injury is lightened. I don't have the numbness going down my right arm and as much anymore. He's done more than a chiropractor has done, than an acupuncturist has done, and I don't need as much ibuprofen, which is really good.
That's wonderful.
I just never knew of this until you mentioned this, so thank you. And he's
Excellent.
right, thank you. Jeremy Warner is his name.
Very good. Thank you. Thank you so much.
Thank you. All right, bye.
I'm glad to hear that, Mary. Let's go to Jack. Good morning, Jack.
Good morning, gentlemen. Dr. Harvey, I spent a couple of days with my sister. She was visiting here from Tennessee, and she came back from visiting my other sister that lives in Sefner, and I noticed that her tongue was like a dark red, almost a purplish color. Huh. Could you tell me, is there any illness or illnesses that might be a symptom of?
Well, changes in tongue color can occur from dietary stuff, inflammation, B vitamin deficiencies like pellagra cause it.
Okay. My other question is gastritis. Is there a cure for that now? I know that they said that there used to not be a cure for it.
Well, I guess I don't use the word cure very much at all, because I think it's a term that comes from Western medicine, where you have to actually get rid of the disease. Well, disease is a a signal in your body that you've done something wrong or that there's something out of balance. And so in reality, you might want to look at getting things back into balance.
Okay, because this is something that happens to myself. It's not very often, but occasionally on the right side, like the lower part of my lungs or the bottom of my rib cage, I'll get kind of like a pain, not a sharp pain, but a really dull pain. And then it'll feel like bubbles or, like a gurgling of some kind.
Mm. Well, that could be actually in your colon.
But I was hoping that it wasn't, that it isn't some mild form of gastritis, because I was under the impression that it couldn't be cured.
Well, gastritis is not something that can't be cured. Gastritis is simply a description of inflammation of the stomach. Inflammation of the stomach comes and goes. And so chronic gastritis means you're doing something chronically to make your stomach inflamed. So is it the alcohol intake? Is it the gluten intake? Is it the dairy intake? Is it histamine-related foods intake? Is it, excessive coffee? There's so many things that could cause gastritis that once removed would allow the gastritis to heal. And you mentioned other things that might cause the redness of the mouth. I forgot to mention thrush, but also pernicious anemia, which is associated with the loss of B12, and also celiac disease might cause it. Anything that causes even gastritis or inflammation of the small intestines can actually do it.
Yeah. Well, I do know she drinks a lot of coffee, and while my mom and her were staying at the Hyatt over by Busch Gardens, we bought 2 12-packs of beer. They were here, a week. And so, we did drink a little beer, and I do drink coffee, at least 1 cup of coffee, decaf, every morning. So I'm going to cut back on the coffee.
Well, actually, the decaf's probably not much. And the thing you described doesn't sound like gastritis. Usually that's right in the middle of your belly at the top. It's burning, associated with acid, belching, reflux. Doesn't sound necessarily like gastritis.
Yeah, I haven't had any acid reflux. I know it sounds crazy and it may not be related at all, but I had a polyp on my not on my colon, but like at the end of my colon where your rectum, I guess, is. And yes. So I had to go to USF to Dr. Bennett, and he said that it was cancer and that he'd seen it before. It was about the size of a jelly bean. And he said, it's 2 centimeters. It's as big as it can get before we have to, do surgery, before we can't offer any other treatment. So they went ahead with the chemo and the radiation. And I don't know if the chemo had something to do with it, but after I was cured of the cancer, I didn't have any more acid reflux at all. I mean, I can eat some of the spiciest food that you've ever seen, and it doesn't, normally I would wake up burping in the middle of the night, and it would be like I threw up in my mouth, something burning and stinging, and I have to get up and, start drinking water until I diluted it before I could go back to bed. And that has not happened in the last 4 years at all.
So maybe it's burning you further down, and that's why you're actually having these symptoms in your right side.
Okay, so it's further down in the stomach, maybe, that the symptoms.
Could be. Down in the intestines rather than the stomach.
And then one other quick question. Is your tongue considered cuboidal epithelium, or is it a different cell?
It is columnar epithelium, I believe, and it's mucosal. So the tongue, the lining of the mouth, though, I think is a squamous epithelium.
Squamous. Okay. I was comparing it to like your gums. A lot of times when you go to the dentist, he'll describe your gums as being pink and stipple, I think.
Yes.
So that's why I was leaning towards cuboidal, but I didn't know what the tongue was.
Very good. Well,
okay. Great day, John. Good information, and I'll recommend B12 I'll start researching the other things that you said to see. I'm not a doctor or anything like that, but
right. So since you're not a doctor, I wouldn't recommend B12. I'd recommend getting it evaluated.
Getting evaluated, okay, to see what the disc. My grandmother had poor circulation, but I don't, I wouldn't even guess that had anything to do with it either.
No, I wouldn't guess. I'd go get evaluated.
Exactly. Thank you, Dr. Harvey.
You're welcome, Jack. Take care.
Okay, I do have Al waiting in the wings, but we've got 10 more minutes, and I don't want to have a rush at the end, but I'm going to give on out the number one more time that y'all are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, and give us a call and participate at 813-239-9663, or continue to send your emails to dj@wmnf.org. Good morning, Al.
Hello.
Hi there, Al. What you got for us?
I was wondering if there's an appliance that can be used for sciatica.
An appliance for sciatica? What do you mean?
Well, I saw a infomercial last night, and it's a thing that wraps around below your knee. And
oh, good. Okay, so what they're doing is selling you BS.
That's why I'm calling you.
Yeah, sciatica is something that is functional. Your muscles aren't working the right way, and you have some pressure on one of your nerves, and one of your muscles is probably in spasm. So the best thing to do is get evaluated. A physical therapist, a muscle activation technique personal trainer, massage therapist, a chiropractor. These people can all help you with sciatica.
Okay, so there's no magic bullet for sciatica, like a pill or surgery?
No, the magic bullet is actually fixing your posture.
Okay. My daughter has straight back, I think she calls it.
Uh-huh.
I'm calling for her, by the way, for my daughter. She's 45, and she was told that it's probably sciatica, but they wouldn't go any further because she's on the county health plan, She was told...
She may have to pay some cash to get some muscle activation technique or some other intervention that might help. But, yeah, it sounds like she's at a dead end wherever she was.
Yeah. Chiropractor better than a physical therapist?
Chiropractors are wonderful. Physical therapists can help. Muscle activation technique therapists that you heard about earlier in the show, they're all very good.
Okay. Thank you much.
You're welcome.
Bye-bye.
Bye.
Thank you there, Al, and best wishes to your daughter. Let's go to Paul in Tampa.
Hey, good morning.
Good morning.
Thank you so much for the program. It's wonderful.
You're so welcome.
I have a question actually for two different friends of mine. They're both with different ailments, but both of them suffer from lack of sleep because of pain and well, the one issue is possibly prostrate issues that he gets up in the middle of the night several times and can't get a solid night's sleep because of that, and he has painful urination as well. They're trying to figure it out. He's been to specialists and so far not coming up with the right answer, apparently. The other friend broke his neck, and he's basically working his way up out of a wheelchair and standing, getting back on his two legs, but it's been a long time now, and still very uncomfortable, trying to get some sleep. And so tell me what you think. What can they do to improve their quality of life and get some sleep?
Well, it sounds like they have sleep problems from different reasons. Right. And so it would be helpful to actually get a sleep history from them. Do they have poor onset? Do they only wake up? Do they wake up early? What's going on with their sleep? This is a too complex issue just to say, oh, here's one thing to do. Melatonin isn't the answer. It's really about what is going on, and you need a doctor who's willing to spend the time and ask the questions. So I'd suggest they find somebody who's willing to do that.
Yeah. Well, I know the one's been to specialists, across the country.
They need to find somebody outside the box because obviously they've been to multiple specialists and it's not working. So maybe a functional medicine doctor would be a good choice.
Yeah. Maybe so. I can recommend it, but, I don't have much control over that.
Exactly. Good luck with that.
All right. Thank you, sir.
You're welcome.
All right, and I do have Mary from Dunedin. Good morning, Mary.
Good morning, Doc.
Hey.
Quick history. I had breast cancer.
So I've lost you now. Sounded like you have throat cancer.
I don't know what the issue is. We'll put her on hold and go to Sheila in St. Pete. Good morning, Sheila.
Good morning, Dr.
Hi, Sheila.
I listen to the program all the time. So I was listening. I was like, maybe he can help me. I've been dealing with, I don't know if it's gastritis or some kind of problem in the stomach. I've been to a gastrologist. They checked everything. I ordered my records, and I read through them all. They checked the gallbladder, no gallstones, maybe a little sludge, he said, very tiny. Liver was good, but they could not see the pancreas because it was clouded with gas, okay? Now, my problem that I've been dealing with since, I guess it's about 2012, and I have not been able to find an answer from doctors as well as my own research. I have, after I eat, like anything, it doesn't matter what it is, spicy, not spicy, anything. I am vegan. I get this burning, okay, in my very center, like between my ribs. My concern is that it burns all the way around to my back. So, and it's every time there's a burning in the back. Apply pressure, it actually makes it feel better a little bit, but it's a burning that I don't know what to do. I'm taking, I don't know if I'm pronouncing this right, omeprazole.
Omeprazole, yes.
I take 30 milligrams of that. Every time I eat, I take a prebiotic, probiotic, and an enzyme.
But none of it has helped, is that right?
I'm sorry?
None of this has helped, is that correct?
None of this is what?
Has helped you.
Well, the enzymes do help.
Okay, good.
That one,
there's a very special, excuse me, we're at the end of the show, so I'm going to let you have some information here. There's a really special enzyme called diamine oxidase, DAO, diamine oxidase. It's available over the counter, and it is something that helps with histamine foods. You may want to do two things. Avoid histamine foods on your vegan diet, and also try diamine oxidase as one of the enzymes you take prior to eating. Thanks a lot for your questions and your input, but I don't have time to go any further now. And this has been...
I will do that. I will try that. I've tried everything.
Wonderful.
Right, thank you, Dr. Harvey.
You're so welcome. And thanks, everybody, for contributing today. I really appreciate your input. There's one email I just need to mention. Never ceases to amaze me, Doc, that drugs are pushed on commercials and the side effects, everything from your genitals falling off to death. Why do people keep buying this stuff? Great email, Peter. I love you. Thank you. And thank you, Bill, for running the boards. Thanks, Irene, for answering and fielding all these calls. And thanks for everybody contributing today.
Well, and thank you, Doc, for another illuminating episode of the Healthy Steps Radio Show here on WMNF Tampa. And until next Monday at 10 a.m., I want to also thank Irene for always helping us with the phones and such. We could not do the show without her. And everyone out there, take care and stay healthy. You have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Waiting at the signpost just ahead is 5 minutes of NPR news, followed by the Sustainable Living Show, hosted by the astonishing duo of Annie Ellis and Tanya Vidovic. Until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.